At Resiliency Brain Health, we help restore function to patients that have been injured. We help improve their function and their quality of life using non-invasive treatments and therapies that are tailored to them as an individual. Most people have been through a gamut of physicians before they come to see us, and they've taken approaches that have either not helped or they've created more side effects that were worse than their original issue. We look at their chemistry and their physiology, and once we can correct their chemistry and we can restore function, they can continue to have what they consider a better quality of life.
So it's definitely clear that the outcomes, short and long term, for the veterans are better when we combine both the mental and the physical aspect. And so what I do with the guys is basically take them and go through different functional movement patterns and help them regain their ability to move in those functional patterns like squatting, hinging, overhead pressing, lunging, stepping up, things that we do in our everyday life, and help them become stronger and more functional in those patterns, especially focused on their core strength and their glute strength and balance. And with that, our hope is to help them regain function that they can learn in the gym, but also apply in their everyday movements outside of the gym.
Now that a week has passed and I'm in my second week, I noticed a big time. I think differently. I think more like I did almost 20 years ago.
Within the first week, I could see my quality of life went way up. I was having just less and less anxiety, and then some days it wouldn't even be a thought in my mind. I would have no issues, back to normal.
It was taking my impulses and controlling my impulses. It was how I responded to people. Like my wife was even like, I can tell a difference in this conversation, how you are talking. I can tell you're in a good spot.
I first started noticing change about halfway through the first week of treatment here, especially with the use of TMS. That helped me actually calm down, feel like I had more energy and be able to think through different problem sets.
I can tell you that there's been a reduction in pain. There's an overall, I'm happy. I'm a lot more happier now than I was before. I'm getting hours of sleep. Everything that I was having issues with have drastically reduced. Everything they do, they explain to you why they're doing it and what benefit it brings to you.
So I came to the program in March of 2021. It's January 2023, so almost 2 years later. I'm feeling great. I'm actually pursuing my doctorate in chiropractic and a master's in clinical neuroscience because I want to follow the path of the docs. Here, I believe in this program so much. I keep up with my exercises daily. They only take maybe 5-10 minutes out of the day, but I've seen just progression throughout, and it's aided me in recovery.
Many of our special operations veterans have sustained multiple traumatic brain injuries throughout the service to their nation. Your donations directly help fund brain injury treatment that is literally life-changing. Additionally, we're aggressively trying to get in front of an epidemic of suicide within our community. We're keeping pills in bottles and guns out of mouths thanks to your financial donations.